I'm going to share with you a secret that not many dentists know. Well, 25% of you know this, but 75% of you don't. Most of you, 75% of you, do not do a comprehensive examination on your patients. The article was written by periodontal treatment for the general practitioner by Curry, Martins, and Bonaker, the American Journal of Dentistry, back in 2006. They've looked at over 235 practices, and I asked a number of questions. Do you do a comprehensive examination? Do you have a periodontal chart? Do you take a full set of x-rays? And if you do you do a comprehensive examination? Less than 25% of the participants over 235 offices did a comprehensive examination and took a full set of x-rays, and that included specialists, periodontists, and prosthodontists as well. What does that mean? It means that most people got the treatment that the dentist saw. And that's a bias. The extraction, the implant, the endo, the Invisalign. You know practices like that. All they do is Invisalign. 90% of the patients do Invisalign because they're in Invisalign practice. Or if you go see a periodontist and they only do flap surgery, or they only do laser surgery, or they do gingival grafting on every tooth that has recession. There are certain practices that do this because it's a knee-jerk response. It's a knee-jerk response to seeing what they see. So what am I saying? I'm saying that it's important to do what we were taught in dental school, but we never really did. I've had about 7 or 8 associates in the course of my career, and everyone I asked, do you practice in your residency program the way we practice in our practice, which I think is ideal. We do a comprehensive examination. We give everybody a diagnosis or the diagnoses, because there can only be one diagnosis. We learned that a long time ago by all the masters in our field, including Morton Amsterdam at the University of Pennsylvania and others. And then we give the patient treatment options so that they can choose what's best for them. Most of the time when I'm teaching residents or I'm talking to one of my students or even some of my associates, I'll say, what do you think we should do? And they go, oh, denture. They don't take it back. It takes the stress off of you if you do a comprehensive examination, because then you take it data. You become data driven. And you do not have to do what you think you should do. That sounds confusing, right? What's our job? Our job is to gather information. That's an examination. Our job is to give a diagnosis. Okay? The diagnosis is based upon examination, and it should be comprehensive. Periodontal, endodontic, occlusal, caries, occlusion, aesthetics, ortho, oral cancer. All of those things should be looked at during your diagnosis. And we gather all the data, which may include cone beam CT scans, full mouth series of radiographs, digital scanning, etc. All of that is gathered at our initial visit. I do have to take some time to do that. I need to take a full hour. Once I have that information, then I can present it to the patient. So I present with them their diagnosis. Now, I don't call it a diagnosis. I call it a problem list. Okay? My exam is I'm going to make an assessment. I'm going to look around your mouth, and then I'm going to give you a problem list. That's what the diagnosis is. And then I'm going to give them solutions. So I always link the problems to a solution. I don't leave them hanging. I give it to them almost right away. I said, these are the solutions. There's not usually one solution. There's usually a number of solutions. We can extract, we can maintain, we can do nothing. So I give them all of the options. And there's a cost and a risk and a benefit for all those. And that, once I gather that information, I give it to the patient. I explain to them what that information means so I can bring them up to this level. And then the patient can make a decision based upon the information that I've given them. I am their dental guide. I am not their dental father. I don't tell the young person what to do. These are your options. This is the cost, the risk, and the benefits. What do you want to do? Guess what? The patient makes a decision that's in their best interest, as opposed to making a decision based upon money or fear or the power and authority of the doctor leading over them. When I go to a restaurant and they show me a menu, they don't say, hey, eat the steak. They don't say, I'm a vegetarian. They go, no, you got to eat the steak. They don't tell me that. They said, these are the options. They don't give me a value judgment. They may say the steak's really good, but they say the cauliflower is very good too. They don't judge whether I'm a vegetarian or a meat eater or whatever I am. They don't tell me what to drink. They don't tell me what to order on the side. I sort of know what that is, and most of you know what that is in a restaurant. When you go to a restaurant, we know how to read a menu. Do you know how to read a doctor's menu if you're a patient? Do you know how to read a menu if you, let's say, God forbid, you have cancer and they give you options of chemotherapy, radiation, surgery, or no treatment, or combinations? Do you understand what that means? Probably not. We have to rely on the authority, the presence, the intelligence of the doctor, and that's what the doctor is. It's a guide. Doctor is not someone that has to treat us. It's someone that's a guide to guide us through treatment and then may administer treatment upon us once we understand things. How can you do that if you're not doing a comprehensive examination? How can 75% of you listening to this video tell me in good faith that you're doing the best for your patients when you're not doing a comprehensive 1-hour examination on all new patients that come into your office? The only time that I don't do that is during an emergency visit. Patient comes in pain, acute pain, I got to take care of their pain. That's the only time I don't. I'll talk to you about the sequence of care in our next video, but right now I'm going to say it's important to do an exam, a diagnosis, treatment plans, and treatment. If you do that, guess what's going to happen? Your practice is going to thrive because you'll have intelligent, well-informed patients that are doing what's in their best interest. Now, a long time ago, there was a store called Simms. It was a department store. And they used their tagline was, name brand clothing for less. And you can go in there and you can buy an Armani suit, or Ferragamo shoes. You can get all this kind of stuff and you wouldn't have to pay thousands of dollars. You'd pay a couple $100 for it. Matter of fact, I'm going to give you a little secret of what I do today. Simms doesn't exist anymore. I do most of my shoppings at Nordstrom Rack. And I wear these sport jackets in, and they're from Savile Row, and people go, that's a beautiful jacket. And they think it's a very expensive jacket. Well, maybe it is if I bought it at Savile Row, but I get it at Nordstrom Rack, and most of those jackets cost me $125. That's where I buy most of my sport coats. And if you shopped at Simms years ago, you'd be able to get the same type of quality clothes for less. You didn't have to go to Saks Fifth Avenue or a very expensive store. And what Cy Simms used to say was this: an educated customer is our best consumer. And I say the same thing to you. An educated patient is our best consumer. They will buy more dentistry from us. That's in their best interest once we educate them. The power of the initial examination, comprehensive diagnosis, and treatment plans cannot be overstated. It's the most important thing I do in my practice. A lot of people come into my office and go, Mike, all you do is talk. I go, yeah, I do a lot of talking to my patients when I first meet them. And I also do a lot of treatment to my patients once they understand what their options are. And that's why our practice is booked routinely 3 to 4 months in advance with a waiting line to get into our practice, because I don't rush people through that initial examination. Could I do more dentistry quicker? Maybe, but it wouldn't be as good. And I wouldn't be being a gift to my patients. So if you're not doing a comprehensive examination, which most of you aren't, think about it. You'll really be able to do a great job for your patients. But let me tell you one hook. Most people will call up and say, I just want a cleaning. Say, sure, we'll give you a cleaning, but after a comprehensive examination. And they're going to say, well, I just want a cleaning. Then they may not be the right patient for you. And I had this conversation with my team this week. They said they deal with a lot of patients that don't understand why we have to do a comprehensive exam. Of course they don't understand, because they never had it before. And the average age in my practice, as many of you know, is a 65-year-old person who's been to the dentist on and off their entire career and now need thousands of dollars worth of reconstruction because they neglected their mouths. They didn't plan on becoming that way. It happened because they never got comprehensive treatment. So that would be a true gift to give to your patients. Think about it, because you will be the gift. Have a great day, everybody.